My name is Justin Gill. I'm a nurse practitioner at Providence, Mill Creek, and Monroe walk-in clinics. And I am a lecturer mainly teaching health policy here at UW-Bothell. Hello, hi. I realized that I wanted to become a nurse actually after I had engaged in opportunities to expose myself to political advocacy and political science. So after high school, I initially chose political science as my major.
No, it's just the cough, but...
It is fairly unique as far as having a political science background and wanting to go into nursing, but nurses are essentially trained to be advocates, and part of that means advocating for patients at the bedside, but also advocating for policy changes. You will definitely want to make sure that you have a mask on to protect those that are around you. Okay. Some of the legislative activities that I've been involved in include being a member of my state professional nursing organization, as well as my national professional nursing and nurse practitioner association. And that really has served as an environment for me to improve my professional skills, improve my advocacy skills, and connect with lawmakers in a more direct way. I just wanted to check in and see if you were planning on attending the Nurse Legislative Day. It's really an important event to highlight priority legislative initiatives for nurses. I have experience in lobbying in Olympia, which is another kind of natural interest for me, but I think that it's really supported by my ability to see patients and understand the issues that they face. My passion is to get nurses involved in legislative advocacy, in clinical advocacy, in any way that they can to find their voice. You don't have to be a lobbyist, you don't have to be an election specialist, you don't have to be a political analyst, you just have to tell your story. Part of the responsibility of telling our stories is for us to be able to have the initiative to come forward, speak up, and inform our policymakers and our leaders of what it is that needs to change and what we need right now to take better care of patients. I think the program at University of Washington-Bothell is particularly unique because it focuses on nurses that are already out in the field. It's a program where you are finding the connection between looking at evidence or looking at policy to the clinical care that you provide at the bedside. The individuals that are taught here are already working professionals that are working to improve their education, improve their understanding of the health system so that they can be a better advocate for patients at the bedside and beyond. Listen to your heart, you can breathe normally. The opportunities for nursing are broad and almost difficult to completely express. You can be an administrator, you can be a manager, you can be a provider, and you can provide care directly at the bedside, both in ambulatory facilities and inpatient facilities. People are always going to need health care, and they're always going to need nursing and nurses. So it is an occupation that will give you both personal satisfaction as well as some certainty in the job market.